That is why it is very important to brush your teeth twice a day, and reduction in the intake of sugary food and sugary drinks. So today's question came from Umar Wakili, and he's asking of causes of dental cavity. Okay, let's start with the anatomy of the tooth so that you understand it more. So the outer aspect of our tooth that is seen is what we call the crown, and this crown is made of a very hard, white, shiny structure which we call the enamel. This enamel is the strongest material in human body. So below this enamel is a pale yellow structure which is softer than the enamel, but stronger than the bone. So this is called the dentine. So inside the dentine is a hollow place where we call the pulp chamber, and the pulp is contained in that pulp chamber. This pulp is made up of blood vessels. So these blood vessels brings in blood which is rich in oxygen and nutrient and take away unwanted materials from the tooth. It also have nerves that comes through this pulp canal into the pulp chamber at the pulp that supplies sensation and other informations from the tooth to the brain and from the brain to the tooth. So also, this is the root of the tooth. This is the pulp canal, the pulp chamber, the pulp, and this is located in a socket in the jaw, which is secured by periodontal ligaments and covered by what we call the gingiva, which is known as the gums. So this is just a normal anatomy of the tooth. Now, what causes that dental cavity? So before you know dental cavity, you have to know what is dental decay. And this dental decay occurs as a result of activities of some microbes, because the microbes present in our mouth can be good or bad. So that bad microbes causes this decay. Different bacteria that cause this decay includes Streptococcus mutans, Streptococcus subrenus, and Lactobacillus. So these bacteria use the remainings of our drinks or food we eat, which usually contains starch like sugar. So the remainings of that food and drink, they use it as an ingredient to produce an acid which decays this hard surface of the teeth. So in that process, we say it causes tooth decay. But our saliva contains minerals like calcium, phosphate, and our toothpaste contains fluoride, or the water we drink. So the saliva will use that minerals to remineralize this enamel. So after the acid attack, so meaning the bacteria will damage some part of the enamel, saliva will recover the damaged area. So this is like a vice versa. So this demineralization and remineralization of the enamel happens almost all the time as long as the person is alive. So meaning your enamel can only be destroyed from acid attack when demineralization from acid attack from the bacteria activity overpower the remineralization from the saliva. That is when you have poor hygiene, you are not using toothpaste that contains fluoride, when you have poor hygiene, or when you are taking sugary drink and food frequently. So early signs of this tooth decay is the presence of white spots around the area of this acid attack. So if this overpowering of the remineralization continues, and the tooth decay continues, so the area of this tooth decay will become weak every day. So the weakening of this enamel, with time, it will get rupture. So meaning this enamel at the end of the day will rupture like this. So when this enamel rupture, the dentine will be exposed. The bacteria will also affect it, and it will rupture like this. So when it rupture, meaning materials from outside the tooth can get in contact with this pulp. And this pulp, like I told you before, it has blood vessels, it has nerve. Nerve takes sensation of pain from the tooth up to the brain. So this production of this hole is what we call dental cavity, like you ask. That is why it is very important to brush your teeth twice a day. And reduction in the intake of sugary food and sugary drinks, the use of gels, toothpaste, tablets containing fluoride. And the best thing is for you to go to the hospital and see your doctor. Thank you.